Hi, I'm Laura Cox, Shield Healthcare's Ostomy Lifestyle Specialist, and today I have a very special guest, Eric Polsinelli from Vegan Ostomy. Hi Eric, welcome. Can you tell me about your ostomy story?
My symptoms and my ostomy story came because of Crohn's disease. And at first, Crohn's disease was not on my radar. I had no idea what it was. I was very active, healthy, young guy, with a young family, and it really didn't occur to me that things like this could happen. But I started getting symptoms, so I went in to see my family doctor. She had me actually go to a surgeon to be scoped. That scope revealed Crohn's disease, and then kind of everything followed from there. So I was officially diagnosed in 2008. I had been on a lot of conventional treatments. I took the alternative therapy route, and I wasn't getting better. And it really got to a point where my disease was so aggressive, it was causing so much damage that it was time for me to consider surgery. Originally it was, let's explore maybe a temporary ostomy. And I was really whoa, no, I'm not doing that. And then when it came time to look at maybe getting a permanent ostomy, I was so sick and so tired by that point, thought, yeah, let's do this. I can't go backwards from where I am. I can only go forward. So let's do the surgery. Let's make this a thing.
At OstomyLife, we encourage a happy, healthy, full life with an ostomy. So how do you do that within your own life?
Before having my surgery, I actually got into a lot of mindfulness practices. And one of the things that some of the people that were kind of teaching that had said was, if you're in pain, if you're going through a struggle, rather than fight that, just welcome it. Welcome it, sit with that feeling, kind of acknowledge that it's there, but don't let it overtake you. And then eventually you just kind of let it pass.
Before surgery, what did you anticipate life would be like after surgery? And now that you're a couple years post-op, have you found that those preconceived notions have been true?
I had no idea really what living with an ostomy meant. Sometimes we hear these stereotypes that people who have an ostomy smell. That's just not true. I had this idea in my mind that having an ostomy meant that I would literally be at home in bed managing this bag all the time. I didn't understand what it meant to have an ostomy. There are a lot of preconceived notions that, well, no, you're not going to be able to do that activity, or you're not going to be able to eat that kind of food, or you're never going to be able to do this, or you're never going to be able to do that. And I don't think that that's a very accurate representation of what living with an ostomy is actually like. So yeah, I had a lot of preconceived notions. As an example, when I had my consultation with my surgeon, one of the questions that I had asked was, so does this mean I'm going to be able to walk around the block with my wife after dinner, or am I not going to be able to do that? I had no idea. So things like that now, just looking back, they almost seem funny to me.
What would be one tip that you would give someone who has just undergone ostomy surgery or is maybe just starting to consider having ostomy surgery?
So I think one of the most powerful things that was ever said to me, and this really helped me tremendously, was from a nurse. And I remember we were actually in an elevator, and she said, it's going to be okay. And I think for new patients to just understand that, yeah, there are changes that are going to happen. There's probably going to be a few difficulties and hurdles that you're going to have to overcome, but eventually it will be okay. You're going to get through this. A lot of the challenges that we face as a new ostomate are very temporary. Trying new appliances, seeing what works, figuring out maybe why I'm having leaks. But once you're past that, then it's just on with living life.
Can you tell us about your advocacy work and why it's important to you?
At the time, I had a few months to think about, preparing for my surgery and whatnot. I ran into people like you who were putting out videos on how to live with an ostomy, but I didn't find anyone who was looking at the vegan aspect of it. And because I had been vegan for 15 years or so, I wasn't too sure how that would go with the ostomy. So I started looking for the information. I couldn't find it. So I had set up Vegan Ostomy really as a hub to get vegans with an ostomy together. But as I started doing more and more advocacy work and sharing my story and connecting with other patients, I realized that the information that I'm putting out really benefits anyone with an ostomy.
What is your biggest accomplishment post-op?
One of the things that I'm really proud of being able to do actually is to travel. Before my ostomy surgery, I would have never considered traveling, but since having my ostomy and just doing the advocacy work, you know, I'm invited to speak at a lot of places. I get to travel for a lot of these IBD and ostomy related events. Another piece that I like to throw out there all the time is kind of my claim to fame. Before my ostomy, I was never really into amusement parks, but my daughter had got me into roller coasters and going.
Wow.
You know, one of the accomplishments that I've had post-surgery was riding the largest, fastest, tallest roller coaster in Canada called the Leviathan 21 times in a single day.
So where can the people at OstomyLife find you, and what can they expect to find when they come to your website?
My home base is veganostomy.ca. That's my main website, but I also have a YouTube channel, which is under the same name, Vegan Ostomy. I also have Instagram and other social media where sometimes I share some of my just personal day-to-day life and other tips, but on my website you'll find a lot of how-to information, daily living information, lifestyle-related, ostomy relevant information. That's the best place to find me, and I'm always accessible.
Well, thank you so much for letting us interview you and taking the time to meet with me.
Thank you for having me.